Next, within the behavior therapy, we have the method of treatment. First, the client or the individual is interviewed so that the therapist can analyze his or her behavior patterns. Then, the behavioral analysis is conducted to find out about three things. First, the malfunctioning behaviors. Second, the antecedent factors. And third, the maintaining factors. Malfunctioning behaviors refer to all those faulty behaviors and thoughts that the therapist recognize in the client. Antecedent factors refer to the causal factors. Antecedent means cause. Okay, so you find out the cause of all those malfunctioning behaviors. Third, you find out the maintaining factors. Refers to the reasons or the factors as to why your client continues to practice those malfunctioning behaviors, why your client continues to engage in those malfunctioning behaviors. Those are the maintaining factors. For example, if there's a young boy who is your client and your client has acquired the malfunctioning behavior of smoking cigarettes. So you are a therapist who practice behavior therapy. The client comes to you. You will conduct behavior analysis on your client and the family members. So you will interview your client and your family and the client's family members, and you will find out that he started smoking when he was preparing for final exam. And he claims that he obtains relief on smoking. So see, you find out three things here. First, you found out the malfunctioning behavior in your client is smoking. So that is known as, so here smoking will be the malfunctioning behavior. And then you find out that your client started to smoke because he was stressed out about his final exam. So what is the cause here, or what is the antecedent? It is the final examination. So you have found out the malfunctioning behavior, you also found out the antecedent factor. Now you have to find out the maintaining factor. Why does your client continue to smoke? Your client continues to smoke because he obtains relief on smoking. So obtaining relief will be the maintaining factor. So once you recognize these three things, malfunctioning behavior, the antecedent factor, and the maintaining factors, you move to the next step. See, once faulty behaviors or thoughts are identified, a treatment package is chosen. So you choose the most appropriate techniques and methods for your client. And the aim is to put an end to faulty behaviors and thoughts and substitute them with adaptive behavior patterns. So you will try to recognize the faulty behaviors, thoughts, and put an end to it and replace them by healthy ones. This is done through establishing two operations. They are called antecedent operation and consequent operation. So taking that same example of the young boy smoking, the antecedent operation would be to find out why he started smoking. He started smoking because he was stressed about final examination. So you, as a therapist, you will help your client to understand that there is nothing stressful about preparing an examination, and that amount of stress is actually healthy, so that the person will have an interest to study, right? So that is the antecedent operation. When you make change in the causal factor in your client's case is the final examination. Next, you also make an consequent operation. Consequent operation is where once you make change in the causal factor, there will also be a change in the consequences. Okay, so when you help your client to deal with stress effectively, your client will now not be stressed, your client will now not smoke and prepare for his exams, right? So when that happens, you have to reinforce your client. You have to acknowledge that your client is doing well now, right? So that is known as consequent operation. There's another example given in your book. See, a child wastes his dinner. So this is a faulty behavior. Wasting food is not adaptive, right? So you find out what is the antecedent factor, or what is the cause of why the child is wasting his dinner. Then you find out that the child eats a lot of snacks in the evening. So this is the causal factor, and so you make change in it. You make change in the antecedent or in the cause, and it will be known as antecedent operation. you ask the mother to feed less snacks in the evening. Next, you will see that the child will eventually eat his dinner properly because he has eaten less snacks. And when that happens, you have to reinforce your client. You have to appreciate your client, right? So that is known as consequent operation. Only when you reinforce your client, the client will be motivated to engage in that healthy behavior more often. So this is about antecedent operation and consequent operation. Antecedent operation is when you make changes in the cause. Consequent operation is when you make changes in the consequences of the change that you had made in the antecedent or the cause.